How's it going, guys? Pass level question? No, I'd say easy to medium difficulty question for ENT step one, pediatrics and internal medicine 2CK. 9-year-old boy, 3-day history, fever, fatigue, cough. Immigrated to the U.S. from China 4 years ago. Temperature 101 Fahrenheit. Hemoglobin normal 14.5 grams per deciliter. Should be 13 to 17.5 in males and non-menstruating women. 12 to 17.5 menstruating women. Platelets normal. 250,000 should be 150 to 450,000. White blood cells super fucking elevated, 40,000 should be 4 to 11,000. And we have 80% lymphocytes, which is a very high lymphocyte fraction. Should be 25 to 33% lymphocytes. Normally, we have neutrophils at 50 to 60%, which is the predominant cell type. Glucose slightly low, 68 milligrams per deciliter, presumably fasting because normal range that I wrote here for you, 72 to 99 is what we expect for fasting. Which is the most likely diagnosis? Let's just hop through. Choice A, ALL, wrong fucking answer. So it's high yield, you know that a school-age kid, any kid, could be an infant, doesn't fucking matter, but a kid who has a super elevated leukocyte count where it's all lymphocytes, 80% plus, that's ALL to proven otherwise. But OMG, you need to know that pertussis is a high yield differential where, for whatever fucking reason, pertussis can cause reactive lymphocytosis where it looks like ALL. So you'll get a kid who white blood cells 50,000, 90% lymphocytes. You're like, oh, that's ALL. But they tell you there's a cough. We don't have to give you the very buzzy, inspiratory Strider type whooping cough. We don't have to give you that. They wanted to make it more challenging. So they might say that it'll sound like ALL, but then they say that there's a cough. They can say there's post-tussive emesis, vomiting after a cough. They can say hypoglycemia, which you can see with pertussis. And it doesn't have to be a kid. NBME can give you 19-year-old with pertussis. Okay. So here it's the unvaccinated status that is insinuated by us telling you that the kid's an immigrant. That's what that means. Okay. So we have enough evidence here to suggest that this is pertussis over ALL. So ALL, wrong fucking answer. Choice B, Croup, wrong fucking answer, aka laryngotracheobronchitis, causes steeple sign on x-ray of the neck. This is caused by paramyxovirus, aka parainfluenza virus. Seal-like barking cough in a school-age kid. They can tell you that the cough is mitigated when his dad brings him outside in the cooler air. So it's just a very buzzy, easy presentation you need to know, and it's supportive care. In theory, you can give racemic nebulized epinephrine, but in terms of what I've actually seen on NBME exams, they're just going to want you to diagnose it. Wrong fucking answer. Choice C, diphtheria, wrong fucking answer. So Crinobacterium diphtheriae, gram-positive rod, non-spore forming, non-motile, and you see it in unvaccinated patients, which this kid's unvaccinated, but the presentation is not diphtheria, which 3 out of 4 times is going to be your very buzzy gray pseudomembrane in the posterior oropharynx. 1 out of 4 questions, they might tell you that a kid's unvaccinated, there's some sort of throat infection. They don't mention the gray pseudomembranes, and they say, e.g., there's myocarditis. Okay, for whatever reason, they want you to know that it can lead to myocarditis, and you can give antitoxin. If a kid has diphtheria, it's too late for the vaccine now, so you're going to give just antitoxin. So when we talk about vaccines, diphtheria, tetanus, pertussis, the diphtheria and tetanus components are toxoids, which are inactivated proteins. So that's actually, I should say that's 1 out of 5 questions, the vaccine, okay? So they want you to know the vaccine's a toxoid, and then 1 out of 4, I mentioned the myocarditis, and then or 1 out of 5, the myocarditis, and then 3 out of 5 would be your gray pseudomembrane with diagnosis. Choice C, wrong fucking answer. Choice D, epiglottitis, wrong fucking answer. So, all right, kids unvaccinated, could be Haemophilus influenza type B. 3 out of 4 questions are going to be a kid who's in respiratory distress, tripod positioning, drooling. X-ray shows a thumbprint sign in contrast to the steeple sign we see with Croup. And 1 out of 4 questions for epiglottitis will not mention a kid in respiratory distress, but they could mention unvaccinated status and You could eliminate to get there, where they give you other outrageous answers, and you're just like, well, it could just be epiglottitis here they're getting at. So you're going to intubate. It's what they want you to know. Even if the kid's not in respiratory distress, it's a medical emergency, you intubate, and you give ceftriaxone to treat. Choice D, wrong fucking answer. You know the deal. Until you make more content, I feel like my stuff's my channel. And I appreciate your time. That's it.